Berkeley UCSF Osher Center Research Seminar. You're in the right place. Today, our seminar is titled Meeting People Where They Are, Implementation of Tele-Yoga in the VA with our colleague Francesca Nicosia. And you all already know how to use Zoom, so you are muted, which is great. And you're welcome to turn your video on at the end when we do Q&A, but can keep your video off now as you have. It will work really well if you put your Zoom window into full screen mode with speaker view or whatever works the best for you. And you can use the chat at any point to send Q&A. I'm just double checking how the chat is set up. Yes, that will work. We will save your questions till the end, but you're welcome to put them into the chat or send them directly to me, Ariana. And if you'd like to receive email notifications about our research seminars in the future and you don't already, you can see the link right here for how to sign up for them. So I'm going to introduce Dr. Nicosia and get started in a minute. And before I do that, I'll just mention that our next research seminar is also on a Tuesday at noon, but at the end of the month, which is different than what we usually do. So it'll be March 29th at 12 o'clock with Dr. Diana Para Perez from Washington University speaking about mindfulness for stress reduction with Latina immigrant mothers. So we hope you can join us for that talk as well. Okay, so Dr. Francesca Nicosia is a health services researcher at the San Francisco VA healthcare system and also an assistant professor at the UCSF Institute for Health and Aging. She has a master's degree in medical and biological anthropology from University of Colorado, Denver, a doctorate in medical anthropology from UCSF and UC Berkeley, and she's a practicing yoga therapist certified by the International Association of Yoga Therapists. Her research uses qualitative and mixed methods approaches to develop, implement, and evaluate non-pharmacologic and complementary and integrative health interventions and care models to improve function and quality of life outcomes among older adults. She leads a multi-site VA Tele-Yoga program and serves as a yoga therapy subject matter expert with the VA's Integrative Health Coordinating Center. So welcome, thank you for being here, and I will pass it over to you.
Great, thanks so much, Ariana, for that introduction. Hi, everyone. It's really great to be here with you all today. Just looking at the names of folks who are here and just seeing colleagues from kind of all over the place, including some VA yoga therapy colleagues as well. So just want to welcome you all. I'm going to share my screen here. Let's see if this works this time. Okay, all right, how's that, Ariana? Is that okay? Great, okay. Great, so yeah, today I'm going to talk about implementation of Tele-Yoga in the VA. So my disclosures, I just want to acknowledge that this material is based on work that's supported in part by the VA's Office of Rural Health, and that my presentation does not necessarily represent the position of the Department of Veterans Affairs or any other institution, and I have no conflicts of interest to disclose. So today I'll give a brief overview and some kind of contextual background about the current moment of yoga and virtual yoga in the United States, and then turn to specifics of the program evaluation for the pilot Tele-Yoga program at the San Francisco VA last year, the current Tele-Yoga program expansion, as well as some next steps, and then hopefully we'll have some time for Q&A at the end and discussion. Right, so I have this question for folks, kind of what is yoga? And I think, the audience here probably is pretty familiar with yoga, but I just wanted to put that question out there as just a thought, right, to think about kind of what you think that when you hear the word yoga, or maybe you practice yoga, or even just popular representations of yoga in the United States. So in the West, right, there's this popular kind of representation of yoga as a form of exercise, right, or a mind-body movement. And kind of, this is picture of the 8 limbs of yoga, right? And so, you know, the green thing on the right-hand side, right, that's the asanas, the physical postures that we associate with hatha yoga, or the more physical posture-oriented practice. And I think that's definitely the most common form of yoga, right, in the United States or in the West, that people identify as yoga. But it's so much more than that. And these 8 limbs of yoga really are a comprehensive set of practices that are a framework to address suffering, right, and maintain homeostasis. And so that's just kind of the framework and the background that I'm approaching this talk from. And so there's, you know, numerous health benefits from yoga, and it's kind of beyond the scope of today's talk really to get into the weeds about various you know, research studies on efficacy of yoga for various conditions. But in general, you know, the increasing amount of research on the efficacy of yoga has shown, you know, synergistic effects of physical and psychological mechanisms of action. And, you know, yoga, like many indigenous wisdom traditions, it's really an experiential and contextual endeavor, and in contrast often to forms of Western and biomedical knowledge systems. And so as researchers and integrative health practitioners, right, sometimes this could pose an uncomfortable tension, right? And I know that, you know, issues around appropriation and equity are kind of at the forefront for many folks at the Osher Center. And so as a medical anthropologist, I'm interested in people's embodied experience of the world and their experience within healthcare systems. And so I can say, you know, the paradigm of more linear and quantitative measurement when researching the impact of various yoga practice often can reinforce kind of a disease-based and reductionistic approach. But we also can look at these more holistic outcomes, right, of well-being in a biopsychosocial and spiritual framework. And you know, veterans specifically, because that's what we'll be talking about mostly today, you know, often present with really complex physical, psychological, and social health related problems. And so yoga really does have a potential as a healing practice to restore this homeostasis and enhance overall well-being. So a bit of background on yoga in the United States. So according to the National Health Interview Survey in 2017, yoga was the most commonly used complementary health approach among US adults. And you can see in the chart on the right kind of shows kind of this breakdown between yoga, meditation, and chiropractic by age. And so yoga on the left, you know, primarily, at least at the time of the survey, was, you know, predominantly younger adults. It's also more commonly practiced among women, non-Hispanic white adults, those younger than 65 years, and people with a higher socioeconomic status. Right, and so this might not be all that surprising with these statistics. I just want to situate them within kind of the broader context in terms of talking about teleyoga implementation in the VA. Okay, let's look at this. Did I think it? Here we go. Okay. Right. So when we talk about, you know, yoga in the United States, we really do have to reckon with a larger history of colonialism, capitalism, and racism that really are more deeply intertwined with the history of modern Western science and medicine. Right. And so as you know, yoga is many threads of indigenous sciences and wisdom traditions and have been appropriated by colonization and white supremacy, which resulting in a particular landscape of representations of what yoga is and who it's for, right? And the Western wellness industry, right, loves to reference Eastern or South Asian traditions, and often without historical context. And so this screenshot, right, is from this screenshot is from a Yoga Journal cover controversy where they had what they call a split run, right? So putting out different covers and seeing kind of which one, quote unquote, performs better. So 2 issues of the same edition. And so at the time, a lot of people really decried this as a missed opportunity, right? For this, you know, journal to celebrate more diverse bodies, right? And this wasn't the only cover controversy, right? Just to kind of give a sense of the extent of some of these issues. Right, and so as I mentioned, right, yoga is intimately tied in with this history of colonialism and capitalism. And the screenshot here is from an NBC News article, right, that shows results from this internet search around YouTube yoga channels. I mean, you can see it's predominantly white folks. And so this really does, just as an illustration of the yoga or wellness industry that has discentered South Asian teachers and teachings, just really one example of who wields power and profit, most greatly from appropriating and commodifying traditional knowledge practices. And so we've seen a lot of harms caused by so-called wellness influencers. This also with regards to anti-vaccine ethos around individualism and mistrust of public health measures, right? And to that point, I've heard from multiple colleagues at other VAs around the country who have had to turn away potential yoga instructors, right, who are not interested in being vaccinated against COVID, and therefore not really able to have a job in a healthcare setting. Right, and so during the COVID era, there's been a changing landscape, right, of yoga during this time, and we've seen dramatic shifts during the pandemic. Right, most notably that most brick and mortar yoga studios have closed permanently. There's really been an increase in video-based yoga. And so these issues around accessibility and equity have been raised by people in the yoga and wellness worlds for quite some time, but this context of COVID has really provided an opportunity for yoga, right, to be more accessible and equitably accessed, affordable, right, for many people who might otherwise be excluded. So this is just the larger context that I wanted to situate what is happening in the Veterans Health Administration with regards to teleyoga, which I'll turn a little bit more to now. Right, so I'm going to talk a little bit about whole health and complementary integrative health in the VA, and just kind of as I know that we had a presentation a couple sessions ago around the VA whole health coaching. And so just a reminder, that veterans represent about 7% of the population and are really, on the whole, they tend to be of lower income education levels, predominantly male, although women veterans are the most fastest growing population of veterans in the country. And there's much higher rates of disability, right, than the general population. And so currently the VA is undergoing a significant expansion in the provision of whole health and complementary and integrative health approaches. Just kind of setting things up a little bit, going back to 2016 in response to the opioid epidemic, Congress passed the Comprehensive Addiction and Recovery Act, and this laid the foundation for expanding provision of evidence-based non-pharmacologic approaches to address chronic pain within the VA. And then in 2017, the VA issued a directive which mandates which complementary integrative health modalities must be offered to veterans as part of their standard medical benefits package. So these are the modalities that VA mandates be available to veterans, either in VA facilities, through referrals to the community, or via telehealth when applicable. And just to note that chiropractic has actually been part of standard care since 2005, so it wasn't included in this directive. Right, but there are still numerous challenges with implementing these C-IAYT modalities. And for example, the San Francisco VA only hired its first chiropractors within the past couple of years. So it's quite variable across the country. Okay, and so some of the basis for including yoga within this those lists or these mandated modalities was this work done an evidence map of yoga for high impact conditions affecting veterans. And this evidence synthesis in 2014, right, found strong enough evidence with moderate effects to recommend yoga, right, as an adjunctive treatment for chronic pain, especially lower back pain, as well as mental health conditions. And since then, there's been an increase in research conducted both within the VA as well as outside, identifying yoga as a treatment that can be offered for women with military sexual trauma-based PTSD, right, and suggesting that it's actually just as effective or more effective than cognitive processing therapy. And so there's additional research, ongoing investigating efficacy of yoga for veterans with Alzheimer's disease, other chronic pain, cancer, and other conditions as well. Right, and so then incorporating yoga into the VA system, right, there's this whole health system transformation that's been kind of ongoing over the past few years. And the VA has placed a significant amount of resource into the system-wide transformation and implementation of whole health, which is potentially a radical shift, right, in the way that healthcare is delivered. I know that Dr. Natalie Purcell gave a great overview a couple of seminars ago just about the whole health pathway and including the coaching program at the San Francisco VA. And so yoga really fits into this model, kind of in the bottom two circles, as part of well-being programs, and as well as can be integrated into clinical care. So there was a survey done with a large national convenience sample of over 3,300 veterans who regularly use VA for healthcare. And it assessed veterans' interest in, frequency of, and reasons for using, and satisfaction with 26 different complementary integrative health approaches. And so you can see that, over half used any complementary integrative health approach, and then 25% practiced yoga. And the main reasons for practicing yoga or other movement therapies was that, reasons included overall health and well-being, as well as pain management. And interestingly, veterans noted they were more likely to use these approaches outside versus within the VA. Okay, so then turning to look at VA kind of national statistics between fiscal year 2016 and 2020, this includes data from about 140 VA facilities around the country, and you can see over time, a huge growth in the numbers of encounters for yoga, and this is in person, right, as well as teleyoga. After 2017, when the C-IAYT directive was implemented, and then obviously there's a dip going into 2020 when COVID happened. And so then this shows kind of the growth in virtual whole health encounters. So, whole health modalities or groups delivered through telehealth over time. And so, right, again, like in fiscal year 19, there's this huge, or into 20, there's a huge jump because of the COVID pandemic. And specifically, yoga delivered through telehealth from the VA had a similarly big jump. So from 2019, a little over 3,000 encounters to into 2020, over 14,000. Right, and so with video-based teleyoga, and so when I say video-based teleyoga, I'll be kind of specifically talking about within healthcare systems or clinical trials, and not just online yoga, right? That you can go to as a person out in the world, right, online, or at a yoga studio or on YouTube or something like that. And so there's really been this explosion, but there's limited research on the effectiveness and implementation of teleyoga programs and clinical trials. Right, some of the research that has been done, right, has identified, some benefits, including convenience, decreased travel burden, and increased access to yoga instructors. And this is really important for people with limited mobility or living in areas with lower density of yoga instructors, including rural areas. And then there's Peter Bailey, who's located at the Palo Alto VA and runs a pretty large clinical and research yoga program. They published some results comparing the satisfaction of in-person versus teleyoga within the VA, and found that the satisfaction really wasn't any statistically different between the two groups, just to note, though, at that time, that's been a few years ago, the in-person or the teleyoga was actually delivered from the main medical center to community clinics where groups of veterans would practice together in person, but the yoga instructor was at a different location. So a little bit different than telehealth to the home. So there's definitely room for more investigations in comparing in-person versus in-home video. And then some of the challenges that we kind of already know about, just audiovisual quality, internet connectivity, right, space, and the home environment, both for patients or veterans as well as instructors, right, distractions of the home environment, and then some potential safety concerns, right? And a lot of these are likely greater in populations that are already excluded or underrepresented in yoga, like older adults, those in rural areas, and racial ethnic minorities. So the San Francisco TeleYoga program. And this is kind of a map of the San Francisco system. It's a large integrated multi-campus system that serves veterans across 7 counties in Northern California. And prior to COVID, yoga was offered at the Eureka Clinic, which is the northernmost part in Humboldt County, in person twice a week. And then in San Francisco, yoga classes were offered in person by VA staff, the clinicians, in partnership with local yoga studios and the YMCA. So they were taught offsite for veterans by VA employees. And so before COVID happened, we applied for grant funding from the VA's Office of Rural Health to implement teleyoga to increase access in the rural areas. And then COVID happened, and we had this sort of like natural experiment where everything just kind of shifted and went online before the grant started. So in March 2020, the in-person yoga classes were paused. And then between April and May in 2020, there was this pivot to virtual groups. And in October of that year, we kind of had this formalization of the TeleYoga program with support from Office of Rural Health. So our pilot program included the following components. We have an electronic medical records-based referral process, as well as a database that we built to facilitate reporting and tracking attendance and demographics, things like that. We also have standardized note titles and the referral pathway that we kind of standardized since the program when it was more formalized. We do intake calls when veterans express interest, and we ask them about their goals for doing yoga, of learning just a little bit more about specific needs, and then suggest the appropriate classes that fit their schedule. And then in addition to that, we offer a virtual orientation session to folks to facilitate the technology and the space set up in their homes, just helping people figure out before they come online to join a class, like where will you be, where will you put your camera, and trying just to help sort out some of the technological barriers ahead of time. We also have funding for props like mats, bolsters, blanket, or not blankets actually, blocks and belts, things like that if people need them. And then the groups have included, anywhere from 4 to 6 classes per week. Most of them are on a drop-in basis, and our classes are all taught by VA employees who are certified instructors, kind of ranging from 200-hour to yoga therapists with trainings in various lineages of Hatha yoga. And so our program evaluation methods it was a mixed methods evaluation guided by the RE-AIM implementation framework. And you can see the kind of domains that we were interested in assessing on the right. We kind of used VA's administrative data as well as structured interviews with veterans and feedback, formal and informal, from our yoga instructors. So in fiscal year 21, so that October to September, that's the fiscal year in the VA. So the program reached a total of 70 veterans, right? And this is almost a doubling of participation, or more than actually 40 new participants who had not attended in-person classes prior to COVID joined during that time period. And we had over 1,200 unique encounters, TeleYoga encounters during that time. We reached a broad range of veterans in terms of location and gender. And so of those 70 veterans, 31 lived in rural areas. Almost half were 65 or older. About a quarter were women, which is, women make up about 10% of the VA, so kind of overrepresented, which changed actually during COVID. So previous to COVID, it was predominantly men. And then some race and ethnicity stats that were these were taken from the VA's administrative database, and so they're somewhat incomplete, but a somewhat diverse group of folks who joined the classes. Right, and so the structured interviews that we conducted with veterans, we just used a convenient sampling approach to recruit veterans to participate in these interviews over the phone. So between August and September 2021, program evaluation staff logged into each class to invite veterans to participate in this voluntary interview. We talked with 14 veterans, and the interviews included a mix of survey items and open-ended responses. for open-ended questions. And so this just shows some of the ratings that people self-reported their, at least, so we asked them sort of over the past month of taking teleyoga, kind of how much did these things improve? And so, most people talked about improved flexibility, increasing exercise and movement, and then other things that you might expect, like reducing stress, and some improving strength, managing pain, mood. We asked people about improving body image, and as well as sleep, and those two kind of were the least, showed the least improvement, right, for people. And then I'll just share a little bit more of the qualitative feedback and qualitative feedback that we heard from veterans. So overall, people's experience with the teleyoga program, it's been really amazing just kind of reading people's or listening and hearing people's responses to how the impact of taking online classes, especially during COVID. And so like this one person said, I look forward to the classes. I feel fulfilled. It truly helps my veteran status. I was a combat medic with lots of memories, PTSD, anger, and all of that's assuaged and helped by yoga. Wonderful that it's body, mind, emotion, all in one place. Right? Another person said, right, it's just what I need. And people talked a lot about the convenience of the classes. And so one person talked about how teleyoga improved accessibility and time management, not having to drive. That would be a deal breaker. I need this to be online. And people also talked about the home environment, right? So, we heard kind of various things about people's experience practicing at home. So, one person said, I'm at home, there's nothing to interfere with or distract me. But on the other hand, some other people talked about how there's like this quote here, there's times it's difficult to focus on yoga because there's lots of things you could be doing at home, right? So kind of mixed responses there. And people also talked about the social connection or the social aspect of online classes. And so, one person said there's good camaraderie. I'm very comfortable with the group, right? And just a reminder too that, we had this group of in-person that had been going, for a couple of years that transitioned online, and then there's new people coming. So, especially for people, I think that kind of had been going in person, the shift to online, there was more of this camaraderie and connection with other people in the groups. That being said, someone talked about missing that group energy of in-person classes. So for people that had gone in person, right, the shift to online, while it was welcome and beneficial, right, there's something missing. And then on the other, kind of on another aspect of this, one person said, I have the freedom to engage or not engage without any disrespect or feeling that I've disrupted anybody. So we definitely did hear from a smaller number of people that, there is a preference for online versus having to interact with people. And so just thinking about accessibility in the online environment, right? The social element, something is that I get asked about a lot, right? And because there have been, positive outcomes related to social connection and the social aspect of being in a group. And so how that's shifting in an online setting is kind of interesting to look at. All right, and then we heard a lot about the impact of teleyoga during COVID. And so this one quote from a veteran says, my wife and I both participate in the yoga program and are appreciative of its being available. We're both senior veterans and found ourselves having to be very careful about when and where we go out during COVID. And then they go on to talk about, staying fit and flexible, and they'll continue the online classes as long as they can. Okay, so some of the factors that impacted the implementation of our pilot program in San Francisco, my facilitators are things that kind of enabled implementation, even though things got implemented before the official start of the program, just because of that pivot during the early part of COVID. But things that really helped is that, the VA has a pretty robust and existing infrastructure for telehealth. We conducted focused outreach to rural clinics, the TeleYoga virtual orientation and support for patients or veterans who needed a little bit more support with the technology aspects. And then we have VA staff who are certified yoga instructors and had some time set aside for teaching. Some of the barriers that we encountered included technical difficulties just with the video platform, and specifically audio visual quality and internet connectivity, which is not surprising. We also didn't have evening classes just because of who the yoga instructors were, and their work schedules were kind of during business hours. And that impacted some veterans who were working or preferred to have evening classes. And then again, the home environment, kind of like I mentioned, kind of distractions, or maybe not having enough space, right, in the home environment. Okay, so then kind of looking into the year that we're in now, so that was the first year of the pilot program in San Francisco, and then we've since expanded the program and evaluation component to a number of other facilities, all the way from Hawaii and the Pacific Islands, all the way to the East Coast. So it's a pretty diverse geographic area, and also just in terms of some of the sites already had yoga prior and were offering yoga. Maybe they hadn't switched to offering virtual yoga, and then there's a couple sites that didn't really have any or much yoga on offer at all. So kind of a diverse representation of different kinds of VA facilities as far as offering yoga. Good. And so this year, really, we're focusing on what we call implementation strategies, or specific things that we're using to help support implementation of the TeleYoga program. So one of the main ones is external facilitation. So kind of working really closely with program sites just to work through like a myriad of different issues. And I think our qualitative analyst team is on the call today. And I know just one of the early comments that they made, because they were doing a lot of observation of these facilitation calls is just like how much time we spend talking about technology stuff and coding and electronic health records and just and all this kind of stuff that doesn't really have much to do with yoga at all, but is just kind of par for the course for setting these kinds of programs up within a healthcare system. We're also working really closely then with clinical champions at each of these sites. And some of them are whole health program managers, some are chiefs of telehealth and integrative health, others are rec therapy supervisors. So it kind of is a really diverse group in that regards as well. And then we're also establishing a community of practice, so kind of a virtual online space to provide sort of ongoing training and dissemination of best practices for VA TeleYoga instructors. And so then our evaluation of the program this year, right? So we're using the REAIM framework just to kind of guide the evaluation, and also really paying attention to health equity. And so incorporating the health equity implementation framework into our evaluation. We have our program database, which is kind of evolving into more of a dashboard to pull in data from all the various different sites. There's a budget impact analysis component, and then we'll be administering surveys and conducting interviews with veterans. And the surveys, we're actually getting ready to launch a survey that veterans can fill out online on their own. So we'll be online or self-administered. We'll be able to reach a much wider, include a much wider group of folks who are participating in the program. And then I mentioned the ethnographic observations, specifically among the facilitation and the implementation activities. So just want to acknowledge like what is becoming a really massive group of wonderful people who are participating in the program. So our evaluation team and Catherine Pham, who's our amazing program coordinator, and then all the different TeleYoga program sites. So San Francisco, the Greater Los Angeles VA system, Pacific Islands, Tennessee Valley, New York Harbor, and the Manchester VA Medical Center. And the picture on the right is from our recent kickoff meeting in January of this past year, where we kind of gathered, not everyone, but many of the folks from across these different sites. And then the advisory committee we had been working with since our pilot year, that includes folks in our National VA Program Office for Integrative Health, the Veterans Yoga Project, and as well as researchers and other whole health folks in the VA. So I think that is all. I kept pretty under my time limit, so I'm happy to open the floor up for questions and answers and just discussion. I know there's a lot of people on here that might have some things to add, so thank you all so much. I'm going to stop sharing my screen now.
Thank you so much for being here and sharing your work. And yeah, I think we have plenty of time for Q&A and discussion, so people are welcome to share questions in the chat, but also if you want to unmute yourself and turn on your video and have a real conversation too, whatever is convenient.
Hi there, I have a question. I really enjoyed your presentation. Francesca, I'm curious to know more about social connection and recognizing the challenges of facilitating yoga classes online. Like, how do you welcome new vets into your group? Do you carve out time to kind of introduce them to the other participants? And is there time for the vets to kind of just share and be in community with each other?
Yeah, thanks, Jen. That's a really great question. Yeah, so generally, yes. I mean, instructors will open up the room, a few minutes early and give folks some time to interact. I think the degree of kind of fostering, like intentionally fostering social connection really varies. And so I think it's something that we're going to be kind of asking a little bit more, specifically in our evaluation this year. That being said, there is, I'm working with a research group out of the Portland VA and Oregon Health and Sciences University, and their research, their research feasibility pilot is specifically looking at using online teleyoga to reduce social isolation and loneliness among older veterans. And so in that, because it's a research study, it's still a pragmatic trial, but it's a little more, there's more of like a protocol, right? And looking at fidelity, I think they're really trying to explore ways to foster the social connection in that study. So I think to answer your question, like it kind of varies. Yeah. Some other questions in the chat. I can just take a look. Okay, yeah, so Jennifer's question. Yeah, so Jennifer, a colleague at the San Francisco VA. Yeah, who's the best contact for referrals? So in San Francisco, veterans will get connected with yoga through the whole health consult, right? So I think if you're familiar with that, right, talking with the primary care provider or any kind of clinician can put in a whole health consult. And if they specify that they're interested in yoga, right, then we'll be contacted for that to get in touch with them. And then the other question you had was what kind of positions are your instructors and what percentage time are they doing yoga versus other duties? So this is a really great question. I'll speak to San Francisco. So the way that the program in San Francisco developed, there was a nurse practitioner and a peer support specialist who were yoga instructors and started offering in-person classes. And we have a way, right, for for VA employees to get vetting and validated, right, and certified in order to offer yoga to our veterans, and then have a little bit of their time set aside. And so I kind of went through that process as well. And so right now, we have a social worker, there's a dietitian, myself, and a couple other folks who offer yoga virtually online. And, last year it was great because we were able to provide a lot of cross coverage too. Like for folks, if we had to miss a class or, scheduling. And so it was really nice to be able to do that. I think this year, we're all finding that we're pulled in many different directions, right? Because none of us are hired as yoga instructors, right? It's kind of like an additional duty that we're either doing on top of or as a carve out for part of our day-to-day work. And so it's been a little bit more like challenging and a little more challenging in that regard. There are sites, and so like every VA is different, right? So there are sites that do have a yoga instructor, like a almost full-time yoga instructor or a contract yoga instructor. And the VA is kind of nationally working on updating the position description for both yoga instructors that have like a 200-hour minimum certification, as well as a new yoga therapist position for a certified yoga therapist. That would be a brand new occupation within the VA to do yoga therapy clinically with folks. I don't know, Jennifer, if that answered your question.
Yeah, sure. Or I'm happy to read them if you rather.
Pronunciation.
Yeah, whatever's easy.
Okay, yeah, thanks, Jennifer. Okay, I'll just go in order here. Yes, so Tina, yeah, specifically, how do you manage safety issue during classes? Are there standards for teleyoga? Yeah, this is a really great question. And again, like, I think this is the response to a lot of questions when you're talking about VA, like the answer kind of is like it depends, right? And so in our VA, and I think this is becoming more uniform across the country, when folks get referred to yoga, they have to have a medical provider clearance, right, for like a gentle movement. And some VAs only offer chair yoga online, just kind of as a way to, versus like a class where people would be standing or getting up and down off the floor. Then there's the issue of cameras, right, leaving cameras on. And so generally that, cameras are on as a safety measure. Although I will say, like, sometimes people need to leave their cameras off for other accessibility types of reasons. And so sometimes in a general class that might be a mixed gender class, right, you might see more women that are present in the class turning off their camera. And so I think each facility kind of has to have their own guidelines and policies around that. And I think as far as the kinds of things that you might do online, right, might be more conservative, right, than you might do if you were in person in a room. Yeah. Okay. I don't know if that answered your question, Tina. Okay. Chloe, is there a sustainability plan beyond the grant period? Yeah, I mean, so because, so we're going into, we're in the second year of the grant, we'll have one more, year. And, part of the grant funding provides personnel support for yoga instructor effort. And I think with part of this year and next year is working with the individual program sites to develop a sustainability plan. So like some that I mentioned already had yoga instructors hired. Others, this is the first time that they're hiring a yoga instructor. And so again, it really varies at each site, just kind of depending on the local climate and kind of the history of how complementary integrative health or yoga has been implemented there before. But because yoga is one of the mandated modalities that VAs are required to provide access to, right, there is a movement toward trying to help sites figure out like how to make supporting yoga instruction sustainable and kind of part of just standard care. Okay, Chanda, do you want to? I can read your question, or do you want to ask it?
Yeah, I can.
Interaction.
For interaction, right? I was just referring to the fact that many veterans experience PTSD. So I'm curious to know if the instructors have any additional training or resources in trauma-informed approaches, specifically maybe, for example, like yoga breathing, using alternate nostril breathing or deep breathing techniques just to kind of manage anxiety or panic attacks.
Yeah, no, that's a great question. So, a lot of the instructors, I mean, in order to be a yoga instructor in the VA, I don't think it's a hard requirement, but that you do have some, training in trauma-informed approaches, either in just clinical care if you're a clinician, but if you're, if you're not a clinician, then obviously having some trauma-informed or trauma-sensitive training. And so, Veterans Yoga Project is our community partner that we've been working with. And so as part of the community of practice this year, we're going to be offering some trainings through them for the instructors in the program. But yeah, I think that there are, there's ways to create a safer space in both in person as well as an online environment in terms of just like orienting people to where they are. And I mean, it's different online than it is in person.
Right.
And also like, and I know you work with the VGX study, is that right?
Yes.
Yeah. And so that's specifically looking at PTSD in veterans. And so, there are interesting conversations, going on. And I think having an accessible approach and trauma informed is great for everybody, right? And also not every veteran has, severe PTSD. And so just being welcoming and acknowledging and giving people choices, right? And how and what they choose to do. And actually in an online environment, like I found personally teaching, it's like in some ways there's trade-offs, right? Being in person, being online, but I think people have might feel like they have a lot more ownership and just empowered to kind of do what they want to be doing, right? Versus in an in-person setting. So
yeah, great, thank you.
Yeah. Okay, let's see who's next. Is anyone else? I see. Oh, Kavita, do you want to ask your question?
Yeah, perfect. I'm actually just pulling off so that I can ask appropriately and not cause anybody trouble, including myself. Thank you so much for a wonderful, wonderful talk, and lots of practical things have been brought up, which I appreciate. I'm actually going to go a little bit different, a little more existential in my question for you. I loved how you talked about the issue of cultural appropriation. It's a tricky subject, I'm of Indian background, and so it's something that I'm really curious about and think about. I have two questions. One is, as you have been thinking about the sort of philosophy, existential questions around cultural appropriation, and some things that are happening in the world, like when we see speakers nowadays, sometimes speakers may acknowledge the indigenous land that we're on before they speak, or it may be in an email footer, as an example. Are there things that you are seeing in the yoga world, either low-hanging fruit or higher fruit, but things that you're starting to see people do to acknowledge that? And then second, and somewhat related to that, is across the VAs, San Francisco Bay Area is a wonderful place to be because I think there's a lot of openness. And as you work with other VAs, if you're working with other VAs, what issues do you see in terms of cultural sensitivity or people's interests or assumptions or expectations as you look across the VAs? And I'm thinking about some of the more dramatic examples, like, yoga classes in Alabama, where they weren't allowed to say, namaste or om or something like that.
Yeah.
And that's a very dramatic example, but just sort of subtleties that maybe you're picking up.
Yeah, thanks. Those are both great questions and like really big. Well, the first one's a really big question, so maybe I'll answer the second one first, just in terms of VA. And I mean, I can only answer from like my own like position here, like in the San Francisco, but connected with these other various programs across the country. And so, so this don't take this as like an official kind of like response, but I think because the VA is a healthcare system, right? And like you brought up, like there might be particular cultural, like, things and just, it within a healthcare system and perceptions of what yoga is, by veterans or by patients, it's like this woo-woo thing. It's Hindu, it's like, it's this or that or whatever, so I think it's all kind, it's like really hard to disentangle actually, but that being said, being able to offer yoga in a healthcare setting that is, trying to reach people, right? I think there is general guidance, like not to use Sanskrit names, for asana, which, I think can be, right. And so it's like, I feel mixed about it. You know what I mean? It's kind of like, yeah, I think there's
complicated.
Yeah, it's complicated. But you don't want to turn people off, and like, is that necessary? I mean, is it like, when I teach outside the VA, like that's how I operate, but inside the VA, it's different, right? And I think that Chenda's question kind of brought up like veteran specific issues, right? Like, or, just wanting to make things kind of accessible for the vast majority of people, but then how do you honor yoga's roots, right? Like at the same time while you're teaching it in kind of a secularized healthcare environment. So I think these are really important questions that I know, I mentioned we're working on standards and qualifications for a yoga therapist position in the VA. And then I know there's a couple of my colleagues from that group who are yoga therapists across the VA that are on this call. And I mean, I think one of the things that we talk about actually, kind of is how to incorporate these concepts within yoga philosophy and other things like the panchamaya koshas and like the gunas, right? And all these different types of things within our note templates, right? Within the VA note templates, and how to kind of translate those concepts, right? And how you might assess kind of someone like holistically using, that. So it's complicated, I guess. And then to answer your first question, I mean, there's a lot happening, in the United States and in the UK, just around trying to make more visible, right? Just like the historical context, right, of yoga. And it's even complicated in India too, right? It's like, right. And in terms of just even the history around International Yoga Day, kind of, and how that came about, and sort of its co-opting by fundamentalist kind of movements, and so I think there's like quite a lot to talk about here, but there's organizations like Accessible Yoga, and authors like Michelle Cassandra Johnson, who's written a lot about, she has this book called Skill in Action. I'm trying to think, like Susanna Barkataki is an author and a yoga therapist, and who's really kind of vocal just around how to honor, how to appreciate and not appropriate, yoga, right? Even as white people, or as anyone, who might not be of South Asian descent. I co-facilitate a study group, kind of with the Community Yoga Center online, and we've been reading different books, just around yoga and race, embodiment, racism in the United States. So I think there's there's a lot out there. If you want it, you can find it. I think even Yoga Journal as a publication is making more of an effort, right, to be more representative and inclusive. So I don't know if that answers your question a little bit.
No, those were tough questions. Thank you for taking the time.
Yeah. Thanks. Okay, let's see. Okay, I'm reading Madeline's question. I don't know if you're there, if you want to unmute and ask your question, but she says, thanks for this amazing talk. I was wondering, what do you view as the role of physicians supporting yoga programming for veterans? What can physicians do? Oh, you're in the library, yeah, okay. What can physicians do to get folks that would benefit from yoga classes, yoga therapy? How can they support the infrastructure in the VA that makes yoga programming possible? Yeah, I mean, that's a good question. I'm not sure where you are, if you're in the VA, or if you're a physician or what, but I think med student and yoga teacher. Okay, cool. Thanks. Yeah, I mean, we have this pathway, right, in the VA, right, so that can get folks connected with whole health programming and integrative health modalities. And so I think just awareness, and our VA in San Francisco has done a lot of work to kind of up the visibility of our integrative health, specifically with the medical practice, with the primary care clinicians. And so I think it takes people that are invested, or at least that understand the benefit, of yoga, and I think for physicians specifically, there's been some research, done showing that, what physicians want, or what, clinicians want is like, they want to see the evidence, right? And so that kind of kind of gets back to what I was talking about earlier in part of my conversation, just sort of some of those tensions between the research or the evidence base for yoga as a holistic practice versus the more sort of experiential or other kinds of types of evidence or forms of knowledge. I know we're getting close to the end of time.
I see one other question in the chat, which maybe you addressed in your answer to the last question. Why not Sanskrit name?
Oh, hi, Patty. Welcome. My understanding is just, to take away a barrier of something or feeling like it's foreign or religious or complicated, right? Just to make it more accessible. So I don't know if I know there might be a couple other VA folks on here. I don't know if you have a better backstory to that, but that's my understanding. Yeah. I mean, that being said, sometimes people do use some, but as a whole, I think generally, using, English translation names. Yeah. Great. Thanks, Chanda. Yeah. Thanks, everybody.
Anyone have one final question, or should we wrap up? Thanks so much, everyone, for attending. Our next seminar is going to be on March 29th at noon, Tuesday, in about 6 weeks. So we hope that you'll join us there. If you've got, I don't know if you want to put that slide up really fast, if that's easy. And thank you so much, Dr. Nicosia, for joining us at the Osher Center and sharing about your work.
Yeah, thanks for having me. Thanks, everyone.
Thank you.
Thank you so much.
Ariana, I'm sorry, I closed the thing.
Oh, no worries. Totally fine.
I'm sorry.
No worries.
I was like
the thing.
panicking.
No, it's all
trying
good.
to open it. Okay.
Hopefully people will find us. Thank you.
All right. All
I'll
right.
see you in
Have
a
a
few
good
weeks.
day.
Okay, you too.
Okay. Bye-bye.